Hello everyone, welcome back to my YouTube video channel. Today I will show you the frenectomy procedure using the laser, Piscaso Laser from the company AMD, American Medical Device. The trick is bending the needle. That's the trick. I'm using Septocaine. And also the way I angle, if I go like this, to begin with, it's painful. So I have to aim sideways like this. Okay? And this way, I walk slowly up, and then back down on this one. So don't go with the needle all the way, and just go slowly a little bit, and go and just a little bit infiltration slowly, but don't put the needle all the way in. That's painful. I want to show you guys what I'm doing. Today I'm doing the laser frenectomy. As you can see that the patient has braces, almost finished braces. Can you bite? So now you can see that the frenum is really go up. So I'm going to do a laser. So today I'm using the Piscaso Laser for frenectomy. So in order to activate this, you initiate with an articulating paper. Take a look. So you have a little bit of burning. That means it's ready now. So I'm gonna go ahead and work on the patient right now. When you do this, you use the surgical suction, okay? So this is a frenectomy, guys. It's not that difficult. It should take a few minutes, 5-10 minutes maybe. So let's start now. Raise your hand if it bothers you, okay? Thank you. I'm going in. It's supposed to be seeing no blood. So no blood. This is no blood procedure, okay? So we'll see. I'm going to use a little gauze to pick up my burning tissue. So while I'm doing this, I'm checking with my patient. Are you okay? No pain?
Yeah.
Okay. You guys see any bleeding? No bleeding, right?
No bleeding.
Other people might ask, like, what other way we can do this? Well, we can use a conventional approach with the blade and cut it. But when we do this conventional blade, you see a lot of bleeding, and this can be frightening. This actually have a lot of vascular tissue right here. But when you do the laser, you coagulate the vascular tissue at the same time, so you don't see any bleeding at all. So that's the beauty of laser, is it's a clean cut. Okay, it's clean cut. It cuts. I'm cutting through the muscular attachment there, and when he smiles, he should see a higher smile line, and it takes several months to recover. It's not gonna be like a beautiful gum in right away, but it will. We give him a very nice smile. So you can see that I'm doing very slowly. I could have stopped right now, but what I'm doing is just to make sure that I really detach and basically cut off the attachment of the frenum to the bone. That's the only way for it to not regrow back. So we will evaluate this condition after 1 month, 2 months, 3 months. By that time, he's done with braces, and we should see the way he smiles. He's gonna show the gum. Right now, it's this attachment right there. I want to clean them all up. First few days doesn't look nice, but it will look nice. So once you do it, you can sometimes you have to reactivate again because it's not sharp anymore. So go in, please. Thank you. So I should be. I would say I'm done, but I'm gonna go back and just show you guys. See, the attachment is gone there. You can see. It was attached like this, right? So we took it away. All the attachment is gone there. But I'm gonna review. I'm gonna do a little bit more. So we're gonna close this like this together. Okay, we'll show you guys. You got it?
Mm-hmm.
My intention was to suture a couple of times, at least to interrupt the suture. But once I suture this up, I feel like one would be good enough, sufficient enough. The rest will be healing by the body. So I'm going to go ahead and do this one big suture and cut it and instruct him not to look at the area. Warm salt water, rinse his mouth, take a couple Tylenol for the day, and pretty much once the anesthesia wear out, he might feel sore. Just like he got a cut in his finger, but it's gonna heal up well. Take a look.